All right, nurses in community settings. Many of you, some of you may, when you finish here, go and work in the community. And we play as nurses a huge role in the community with education and ensuring that patients are well informed and safe. So that's the main gist of what I want you to get from this chapter are what are those things as nurses that we do that really contribute to that community safety and for our patients that are out in the community, because reality is that not all patients we take care of are going to be in the acute care setting, in the hospital setting. We're going to take care of people that are out in the community. Some of us might work in outpatient clinics and things like that. So it's a different type of care that we do when we're in the community. Med administration, we do this at homes, at schools, at work sites, okay? We're the nurses. We're on ground zero. We're at the front lines. We're the ones doing this. And thankfully we are, because we are trained, we're professional, and we can do this safely within our communities. All right, patient teaching, utmost importance. Obviously, that's the biggest thing within the community. And in particular, the 5 categories that you have to include for patient teaching. General teaching. So in general, what do they need to know? Diet. What types of things that they need to know that have to do with their diet? Do they need to avoid certain foods? Or should they eat certain foods like iron? Should they, we want to encourage vitamin C for the absorption and things like that. Self-administration techniques. So if we have a patient that's going home on self-administered insulin or heparin, Lovenox, things like that, we got to discuss and teach them how to administer it. Side effects, what to avoid. Again, side effects to look for, teaching families what side effects they might be. Cultural considerations. Okay, so making sure that we have that cultural piece, but that we don't generalize all people to their maybe particular culture, because they may not identify with everything within their culture. Patient safety obviously is the primary concern here. And we want to make sure that medications, we teach patients to keep their medications in the containers that they were distributed in. That they follow up with their physicians for refills, for testing, laboratory tests, or other diagnostic testing that they might need to be doing, following their blood pressures, blood sugar levels, so that we can get an accurate reading and an accurate trend on those things when we're trying to get them to a better place medically. We want to make sure that they understand therapeutic effects, length of time that is needed. One example of this is, I had a patient who I prescribed a steroid for a rash that she had, and she was under the understanding that it was going to go away right away. She didn't realize that the redness is going to take days to go away. Although it's getting better, it's not getting worse, but the redness is still going to be there. And so educating them on those types of things is important for us as nurses. Refills, talking about when refills are available, especially when we're talking about controlled substances. We have to educate that if you run out, you're not going to be able to get unlimited refills. So keep that in mind. And just making sure that they understand the community resources that are available to them. Okay, diet. So food interactions, drug food interactions, foods to be avoided, encouraged. Talked about that earlier. Self-administration. Okay, so this is something that I've had experience in my personal life with, and you guys might have as well. My sister-in-law had to have heparin her entire pregnancy, and she had to administer the shots. Well, she just couldn't give herself a shot, so I had to actually teach my brother how to give her a shot, and he was over the top, just could not even fathom having to do this. But by the end of the pregnancy, he was just a whiz at administering this sub-Q injection. And so this happens all the time. It can be for long periods of time or short periods of time, but we need to make sure that they're doing it safely. Side effects, I talked about this. They may not know what side effects to look for. They may not realize that headaches are a side effect of the seizure medication that they're on, or that other side effects, itching, is a side effect of certain medications. They may not realize that, and that we can help them with that if it's happening. So we have to educate them on these side effects that could occur. Um, like I said, that cultural piece is so important in anything we're doing when we're educating. And the big piece here that I always try and drive home is that, someone might identify with a certain culture, but they might not identify with every single piece of that culture. And so we have to avoid generalizing everything for them. And seeing that person as an individual and as a human, and dealing with them on an individual basis, and how they view health and their personal beliefs, and helping them to embrace what we're trying to do, and that's to get them back to health and make them better. Home setting, some of you may be home health nurses. It's a wonderful career and profession. We need home health nurses. I commend home health nurses because, I always sort of attribute it to this. Home health nurses, though the patient acuity is much less, you're out there on your own. And so if anything goes wrong, you're a one-man show, or woman show, of course, but you are on your own. In the hospital, you got backup. So I commend home health nurses, and I respect them so much. Same thing with school. You are it. You are on ground zero by yourself, taking care of a school full of kids. So understanding policies and procedures of medication administration, making sure that you're safe, making sure that you're using universal precautions, making sure that there is documentation, because you're not going to have a formal EMR with you. So just following all of those procedures is critical. All right, work setting, again, same type thing with the home health and school setting. And then utilizing the nursing process, checking, double checking, 5 rights, 3 checks. We're doing that whenever we're administering medications. I do that when I'm at home administering medications for my kids. I make sure that I check and double check, and especially if more than one kid's getting medication, I don't want to overdose. So really utilizing that nursing process every single time we administer medications.